I'm here to talk to you about intramuscular Narcan today. So this is Narcan or naloxone, and I'm going to tell you about it and how it is used. Narcan is an opiate antagonist, and so what happens is if you are in an opiate overdose, your body gets so comfortable, it feels so good that it decides that it doesn't have to breathe anymore because opiates are respiratory depressants. So what the naloxone or the Narcan does is it comes in, hits the same receptors that those opiates does. It'll come in, pull those opiates off of those receptors and block it. Those opiates are still in the brain bouncing around, but they can't get into that receptor for the time being because the Narcan is blocking said receptors. After time, about 15 or 20 minutes, this Narcan will start to loosen up and the opiates will be able to rebind. So it's not a permanent solution, but it does allow people to breathe on their own temporarily. When reversing an opiate overdose, it's important to make sure that the person who's experiencing the overdose is as comfortable as possible. We suggest stimulating them with a simple sternum rub, pinching the back of the arm. What we will see is people kicking, punching, slapping, throwing ice over people. That's not what we're trying to do here. We're just trying to cause as little distress to this person as possible and make them as comfortable as possible. If they're not responding to the pain and the "hey bud, wake up," we give them what we call a verbal Narcanning. "Hey, I'm gonna Narcan you." At which point, if they don't respond to that, it's okay to go ahead and administer the naloxone. We're looking for signs of opiate overdose as well. We want to make sure that the person is unresponsive. They're not breathing. This means they might be turning blue, have sweaty or clammy skin. They might have a raspy or gurgly breathing noise. It might sound like snoring or what we call a death rattle. These are signs of opiate overdose, and that's when we would give the sternum rub or the verbal Narcanning. If they're still unresponsive, this is how the naloxone is administered. There are two types of injectable naloxone that we're currently seeing in San Francisco. There's the Pfizer naloxone or the Pfizer Narcan and the Hikma Narcan. Both of them are the same. They work the same way. They just are made by different manufacturers. Simply pop the little tap off. Carefully remove the cap and pull down. You want to make it so that the needle comes down to the bottom of the rubber piece and simply pull down the whole vial of naloxone. Responding to an opiate overdose can be really anxiety producing, and your adrenaline gets going and you can become very shaky, which is one reason why people don't necessarily prefer the IM Narcan. But I'm going to show you a trick that helps to make sure that you get the full dose. So again, pop off the tab, but this time we're going to pull down the plunger just past the 1. You're going to, again, insert the needle in and pull down to the rubber piece. Now you're going to shoot all this air in here and the pressure will start pulling the naloxone in itself. And you can help it out here too for a faster draw. But this way you get the whole dose in here with less anxiety. We do not need to worry so much about the air that is in here because it is going into a muscle and not directly into the bloodstream. Still, it's okay to get some of the air out, but we do not want to lose this medication. Intramuscular naloxone can be administered in any muscle, but we suggest the deltoid or the outer thigh. The most important part of reversing an opiate overdose is rescue breathing. Remember that this is a respiratory depressant. So, breathing for the person is the best thing that you can do. If you don't have naloxone, you can reverse an overdose simply with rescue breathing. It might take a minute. Narcan is your friend. You have options when it comes to the type of naloxone that you're using. Currently, we're seeing nasal naloxone, and the intramuscular naloxone. Now, there are benefits to either. The reasons why I like intramuscular Narcan is because you can choose the dose. You can give somebody a quarter or a half of a vial if they're not in a full opiate overdose. You can choose how much you're giving them and adjust it based on the needs of that person. With nasal naloxone, you have to give a full dose every time, whereas you can give a full dose of the intramuscular naloxone and then according to the situation that you're in, decide to give a quarter or a half of a dose of naloxone. We don't want to be causing harm to this person. We don't want to be causing discomfort to this person. And if this person is opiate dependent, they're going to feel really ill when they come back, which brings me to the next point. After the person starts breathing on their own and they come to, they're going to be surrounded by all these people. Every opiate overdose is very different. So this is just a scenario. It is very important that we let the person know, hey, I'm so sorry I had to Narcan you. You were overdosing, you weren't breathing, you weren't responsive. This is what I did. Can I do anything for you? Let them know the situation that they're in and be kind and compassionate for that person. So Narcan takes 2 to 3 minutes to start working once administered. So it is important to wait 2 to 3 minutes in between doses of naloxone. In a medical emergency, 2 minutes can feel like a lifetime. So it is important to brace yourself, stay mindful, and centered in the situation. Naloxone, once administered, takes about 15 minutes to start wearing off and about 90 minutes to fully wear off. So again, when somebody comes to, it's nice to let them know, hey, I know you're not feeling well right now. In 15 minutes or so, you'll start to feel a little bit better. After somebody is Narcaned, they're not going to be able to get well, get high, or get the results that they're trying to get from using whatever substances that they're trying to use, if it's an opiate. And so it is important that they don't use in that time frame. If they do, the naloxone is still sitting there on the receptor and those opiates won't be able to reach it. They won't be able to bind to the receptor, and once that Narcan wears off, they'll be more likely to fall back into an overdose. Naloxone kits come with 2 doses. Today we're talking about the intramuscular Narcan, so it's important to note that these are light sensitive. So we pass ours out in these amber baggies. Sometimes you'll see them passed out in these little black biohazard containers to protect them from the light. It's also important to note that your naloxone should not be stored somewhere really hot, like the trunk of your car, or really cold, like your freezer. Remember that naloxone or Narcan is safe, simple, and effective. You're protected under the Good Samaritan law if you use naloxone to reverse an opiate overdose. Just to recap, if you find somebody unresponsive and not breathing, they may need naloxone. So we're looking for signs of opiate overdose. They may have a gurgly or snory sound, sweaty, clammy skin, pale, blue. But the big picture here is unresponsive, not breathing. Try a sternum rub and a verbal Narcan. Hey, I'm going to Narcan you. Administer the naloxone into a muscle. And then perform rescue breathing for 2 to 3 minutes before administering another dose of naloxone if needed, as needed. Continue to do rescue breathing. If you have any questions about how to use Narcan or naloxone, you can talk to your coworkers, your supervisors, or contact any local needle exchange program. We'd be happy to help you. Here is a list of places in San Francisco that you can get naloxone. Thank you for joining us today, and hopefully you don't need it, but it's better to have it and not need it than need it and not have it.